Now again coming back to vagina, you should understand prolapse is a major problem for females, especially the bulky uterus or after pregnancy or any major operations. Prolapse is a major complication. So what happens is when there is prolapse of the uterus, it can also result in vaginal prolapse. Now you can very well understand right in front of the vagina we also have the urinary bladder. Posterior we have the rectum. So prolapse of the uterus and the vagina may cause a compression on the bladder, and bladder can prolapse as well. So that is called as cystocele. Cystocele meaning prolapse of the urinary bladder. So if a cystocele is taking place, what the doctor does is, as a surgical approach, the doctor goes via the vagina, because anterior compartment, anterior to the vagina is a bladder. So they go via the anterior part and they make an incision and they just repair the whichever prolapsed tissue of the bladder, keep it in place and tie it off. This is called anterior colporrhaphy. Colpo meaning vagina, raphy meaning suture repair. Same way, there can also take place a rectocele meaning prolapse of rectum. In that case, the physician will go via the posterior wall of the vagina, makes an incision, repairs a prolapsed rectum and then sutures a vaginal layer. So this is called as a posterior colporrhaphy. Sometimes when the patient has both the conditions, you will have to report the code for anterior and posterior colporrhaphy. Perhaps if there is also an enterocele, prolapse of the intestine, they can also do that as well. Here the coding of mesh is very important, because mesh as a prosthetic device can be kept in the anterior or in the posterior compartment. So you will have to know if they are placing mesh in the two compartments, you will have to report the add-on code for mesh placement separately ×2. If they are placing two mesh in the anterior compartment, you have to report only one code. But if they are placing mesh on both the compartments, you can report the add-on code separately.